Hi, this is Dr. Stephen Katz, owner of the alternative medical clinic based in Scottsdale, Arizona called Naturopathic Physicians Group. And welcome to Your Health as Well. I'm your host alongside with my co-hosts, Dr. Loreena Ryder and Dr. Hannah Lindsay. We're here to help navigate you towards your journey of wellness. But we like to do it simply, without all of that horrible medical terminology that everybody hates. We want you to understand so you can use what we tell you and have a better life. Everything we do, it's simple, it's natural, and it works. And if you are struggling with your health and you need a good physician, you can come see us at Naturopathic Physicians Group to help get your life back.
Hi, everyone. This is Dr. Lindsay. Every week, we like to start out by talking a bit about what is a naturopathic doctor. So a naturopathic doctor can provide primary care as well as specialized care. We look at the body as a whole and determine the root cause of your symptoms. So instead of just focusing on your symptoms or looking at your body in parts, we look at the body as a whole and get to the root cause of your symptoms, and that's what we end up treating. So we treat the cause rather than just treating your symptoms. Our initial appointment with you is usually about 1 hour. We believe that prevention is the best form of cure, so we want to help you get better and stay better and truly improve your quality of life.
This is Dr. Ryder with your topic of the day. Today we're talking about psoriasis. Psoriasis is a skin disease. It causes a rash with itchy, scaly patches. And the most common areas that it's seen on are the knees, the elbows, the torso, and the scalp. Now, psoriasis is quite common, but it's, unpleasant for those who have it. It's very frustrating, embarrassing. It can be painful. It can interfere with sleep, make it hard to concentrate even. And there are flares that can last for weeks to months, and then they subside for a while. This isn't contagious, and it won't spread from person to person.
That is something because oftentimes it can be caused by an infection, and so because a lot of infections are contagious, people fear they will pass it on from person to person, but this one is not contagious. It's also been told that it's not curable, but manageable and capable of going into remission.
Right. Some of the demographics that people that you would mostly see with psoriasis, generally between ages 15 and 35. And, children, even younger than that, can have it, but likely those are the ages. And it's about a 50-50 split between male and female.
Equal opportunity.
According to the International Federation of Psoriasis Association, nearly 3% of the world's population have psoriasis. So that's about 125 million people. So that's pretty prevalent. It's prevalent enough that you may know someone who has it, or you could struggle with it yourself. But there's a lot of different causes, or you could even call them triggers, of psoriasis. And one of the main ones is going to be a weakened immune system or other autoimmune diseases. Psoriasis usually is happening due to an overactive immune system that is attacking healthy skin cells. So your own immune system is attacking your skin cells. The body's immune system is overreacting and speeding up the production of new skin cells, which causes the scaly patches that you see in psoriasis.
Yeah, it looks like a thick patch for most people when they get it. So when the immune system is putting new cells on, it's putting too many cells on. So it gets that thickness, that patchy look to it. But as Dr. Lindsay was saying, that weakened immune system is a huge trigger. So it's seen with a lot of patients when they have autoimmune diseases. And we've said before on this show that if you have one autoimmune disease, you're very likely going to be either susceptible or already have more than one autoimmune disease. And so psoriasis can definitely be one of those. And vice versa, if you're really young and you have psoriasis, if you don't know the cause of it, it's possible that you might have an early onset autoimmune disease as well. So it'd be something to test and check to make sure that you might be able to catch this really early and get it before it starts causing major issues.
Yeah, any autoimmune triggers, any immune system attacking, such as HIV, even an acute upper respiratory infection, that's especially in children, will trigger psoriasis. And there's something called Koebner's syndrome or Koebner's response. This is when you sustain an injury, or it can even be a sunburn, something as small as an insect bite or a small cut. It will actually cause the body to produce the plaque patches at the site of the injury. And 1 in 4 people with psoriasis will have this effect.
So if you think about it from a point, if you got the cut, like you're talking about, or you got a bug bite, something like that, your immune system gets triggered. Since this is an autoimmune reaction, when the body tries to send the immune cells to patch it up and fix it, it's going to send the extra cells and cause that plaque. So just like we were saying earlier, it's an autoimmune type reaction. And you said 1 out of 4.
Mm-hmm.
So if there's 125 million people with that.
Oh, do you want me to do math?
Well, 31.25
I'll check you
million people. Check that, see if I'm right. So it's a lot of people out there. Don't test my math skills. If I'm wrong, I just did that live. Great, never hear the end of it. Other triggers, alcohol is a big trigger. We say alcohol is a trigger to a lot of things. Pretty much every week we talk about alcohol as a trigger because alcohol is not good for you. Are we still doing dry January over there?
Yes, we are. It's
Nice
going
job.
great.
Nice job.
I feel amazing.
I'm still in dry 2023.
Yep. So far, me too.
So far, so good.
So smoking can also be a trigger for psoriasis, like alcohol. So if you smoke, obviously is not going to be helping the psoriasis at all. Stress as well can be a huge trigger of psoriasis. And if you think about it, this all makes sense because stress can weaken your immune system. Smoking and alcohol affect your immune system. So if you're weakening your immune system, then that's making you more likely to trigger an outbreak of psoriasis.
They're all inflammatory. Stress, alcohol, smoking.
Mm-hmm. And any hormone changes that are rather sudden, such as puberty and menopause, can also trigger psoriasis. And then blood sugar being high, such as in diabetes and obesity, have a significantly higher risk of causing that development of psoriasis.
And a lot of psoriasis is fungal mediated again, and we'll talk a little bit more about that in a moment. But fungals tend to thrive when your immune system is weak. Fungals feed on sugar. So we've talked about diabetes. We did a whole episode on diabetes type 2. But if your body is constantly in a higher sugar state, it's going to feed all of those pathogens. It's going to increase your risk of cancers because cancer feeds on sugar as well. So again, if you've got diabetes and it's not being controlled properly or well, didn't say good there. Mm-hmm. I'm getting better in my English. I probably said something wrong in that sentence.
No, you're good.
But the blood sugar issues definitely increase your risk of psoriasis significantly.
Some of the symptoms you might experience with psoriasis we'll talk about whenever we come up after the break, but there's so many and it's so variable when it comes to psoriasis.
The main one's really that patchy skin, though. That's going to be the biggest thing that you notice. It varies from person to person. It can look like dandruff, scaling, to full body eruptions, but it does vary from person to person.
So thank you for tuning in to Your Health is Wealth. We are the doctors from Naturopathic Physicians Group located in Scottsdale, Arizona.
Today's topic is psoriasis.
So every week I do a segment called What Isn't Your Doctor Telling You? As always, this is not an anti-doctor segment. Just when you see your doctor in your primary care and you only have about a minute and a half to talk to them and then they try to tell you everything that's wrong with you, they really can't give you all of that information. So I do this segment to kind of give you some information you may not hear in that minute and a half appointment you have with your primary care. So when you get sick, this week is with psoriasis. So when you get sick, whether it be a cold or bacterial infection, your immune system gets activated. Since psoriasis is autoimmune and gets triggered by overactive skin cells forming, as your immune system gets activated to treat the infection, it can also treat or trigger a psoriasis flare. So a lot of times people will be in remission, doing really good for a long period of time, and a simple cold will cause them to flare. They then kind of freak out going, oh my God, what did I do wrong? And it literally could have been as simple as a cold that triggered that flare. So that's kind of an interesting thing when you're dealing with psoriasis. And again, when you treat the cold, if the stress goes away, oftentimes the plaque will clear up again as well. But did you know, this is kind of an interesting fact on psoriasis. Did you know genes and genetics have actually been linked to people with increased risk of getting psoriasis? those same genes have also been shown to increase our body's ability to fight HIV.
I did not know that.
Did you know that?
No.
Do we think it's worth it?
Maybe.
You might fight off HIV a little bit
But
better.
kind of interesting, though, because HIV patients oftentimes have a lot of fungal issues, and yet people with the gene for psoriasis seems to have protection against HIV. Now, I'm not saying if, be promiscuous if you have this gene and you have psoriasis to go out and try to get HIV. Don't do that. But in general, though, it's kind of an interesting fact.
I appreciate your interesting facts.
Genetics as a whole is so interesting.
Mm-hmm.
Yeah, one person's trash is another person's treasure.
Except it's the same person.
Well, some people have good trash and other people have good treasure.
So symptoms of psoriasis, it can vary a little bit, but like we said, the patchy rash is really the main thing you're going to experience. It can vary a lot from how it looks from person to person. It could be spots of dandruff-like scaling, and then it ranges all the way to like major eruptions all over the body. Some characteristics might include salmon red color, overlapping silvery, shiny scales. The scales tend to be well circumscribed, which means that there are definitive borders. But the rashes do vary in color. You could have purple with a gray scale on brown or black skin, or pink or red with a silvery scale on white skin. So the complexion of the individual can also make the rash vary quite a bit.
There are small scaling spots, these are typically seen in children, and then you might also have dry or cracked skin that bleeds. There's something called an Auspitz sign. And if you actively have a psoriasis lesion and you peel off the scale, it might result in what's called pinpoint bleeding or pinprick bleeding. Just those little tiny spots of blood underneath that scale that you've peeled off. Also, itching, burning, or soreness. Only about 30% of the people experience itching of the lesions. And the onset's gradual, and you may have remissions and eruptions going out through the course of psoriasis.
And when they do heal, they do not usually leave any scarring or anything like that. Especially, it usually doesn't affect hair growth. You can usually grow hair in that area and you won't lose hair once it clears up oftentimes as well. But the areas of the body that are typically affected, again, hairline of the scalp, knees, elbows, wrists, the butt area, low back, tailbone area, can occasionally hit your eyebrows, other areas, your nails. There's other places too, but basically it has a sign.
Mm-hmm.
So there's lots of types of psoriasis out there. And of course, the one we're talking about, the most common one is going to be the plaque psoriasis, because this is the one that causes that dry, itchy, raised, plaque covering, scaly looking skin. You can have a few patches, you can have a lot of patches. And again, all those areas we're talking about, it can be any of them. But they're generally post-inflammatory, temporary changes in skin color. That's pretty much the look.
Mm-hmm.
There's also nail psoriasis. So psoriasis can affect your fingernails and toenails, and this is going to cause pitting or abnormal nail growth and discoloration. So psoriatic nails might even loosen and separate from the nail bed. And this, severe disease, severe psoriasis, can even cause the nail to crumble. So nail changes is definitely important to mention to your doctor as well.
There's guttate psoriasis, and this primarily affects young adults and children. It's usually triggered by bacterial infections like strep throat. It's marked by small drop-shaped scaling spots on the trunk, arms, and legs. Boy, strep throat really is a booger, isn't it? It can cause so many different things.
It can create boogers.
Yes, it can.
Well.
There's also inverse psoriasis. This mainly affects the skin folds of the groin, buttocks, and breasts. It causes smooth patches of inflamed skin that worsen with friction and sweating.
This is the one I was saying how a lot of psoriasis is mediated by fungal infections. The inverse psoriasis oftentimes is fungal. It can trigger this type. So there's also, systemic fungal infections are usually when you have the chronic issue where you're going to have a chronic history of a lot of different symptoms out there, including the psoriasis. It's another reason why you should stay clean and take showers, because this is more prevalent in people that don't shower and smell.
Pustular psoriasis is a rare form of psoriasis.
You're so good at that.
At redirecting.
Redirecting. She's our professional redirector.
Pustular psoriasis, like I said, a rare type, it causes clearly defined pus-filled blisters. It can occur in widespread patches or on small areas of the palms or the soles.
Erythrodermic psoriasis is the least common type. Good, because it's the hardest to say.
And spell.
Yeah. It can cover the entire body with a peeling rash that can itch or burn intensely. It's short-lived, or it can be long-term.
But probably one of the most known psoriasis, other than just the plaquey one, is psoriatic arthritis. So these are people that have psoriasis. The body, since it's attacking itself, it doesn't just attack the skin cells, it also attacks their joints and causes joint damage and stiffness. This tends to be worse in the morning, but this type of joint pain or even the psoriasis can also come and go. This one has links both genetically and environmentally.
So some traditional diagnostic tests that might be run to diagnose psoriasis, a physical exam is going to be the main thing, as psoriasis is going to have very obvious markings. So you're going to assess the skin, assess for any other potential factors like the arthritis, the psoriatic arthritis. So check the nails, check for joint pain, things like that. History is also important. As we mentioned, it can be linked to genetics. So a test called HLA-B27 is a blood test that's looking for a genetic marker for psoriatic arthritis. This marker is also linked to other genetic conditions such as ankylosing spondylitis, acute anterior uveitis, and psoriatic arthritis.
Yeah, you really want to look at labs to assess autoimmunity because if you have one autoimmune disease, the likelihood of you having another one is very high. And so if you have an autoimmune disease already, you're more likely to have psoriasis or even a different autoimmune disease.
And if you have a genetic marker predisposition to these conditions, that doesn't mean you're going to get these conditions either. It's just a predisposition. But if you do have one reaction like a psoriatic arthritis, you're very likely or higher risk to developing one of those other ones as well. But you should always want to assess labs, especially autoimmunity. There's so many autoimmunity conditions out there, and you could be undiagnosed for decades and still be in you.
In young kids and teenagers, if rashes are appearing with skin patches, you want to make sure you're going to assess for strep throat due to that gutate psoriasis. Self-inflicted assessments can be helpful as well in terms of alcohol consumption, smoking use, and also any stressors in your life.
This is basically the part of your life where you have to be honest with yourself. If you have chronic issues, if you have autoimmune diseases, and you're taking a six-pack down every day and other stuff like that, you've got to be honest with yourself and let you know, are you creating your own problem? And alcohol is a big one, smoking is a big one, and stress, if you want more children, stress in your life is not always going to be good. So if you're happy with how many you have, you should stay there.
I feel like some people who...
I'm in trouble for that one.
Some people who have these issues and they are smokers and they are heavy drinkers, they aren't ready to make that change yet, so they don't get to the doctor and begin that journey. So everyone's in their own space.
It is that. I've said many times, it's that control. You control what you want to control, but if you want to be healthy, you have to control what you can control. And so if you are doing things that are horrible for your immune system and then you're sick, look in the mirror. Right.
So we're going to talk about some traditional treatments whenever we come back. And, if you've been to a dermatologist and you have psoriasis, you'll likely be familiar with a lot of these.
So from a traditional treatment, we're going to jump right into, and we always say in the beginning that we are never telling you not to do your medications. We're just giving it information here. And if it's something that appeases to you, you can go talk with your doctor to see what's the best care for you moving forward. So the first line therapy that they use for psoriasis is something called emollients. These are basically just moisturizing treatments. They help with people that have the itchy, the scaly skin. Most of these are over the counter. They're easy to find. Oftentimes right on the box it'll say, this is for psoriasis. So these are not usually hard to find, and very rarely is your dermatologist or any doctor that's going to actually prescribe these.
There's also topical corticosteroids. This is for mild to moderate cases of psoriasis. These decrease inflammation to the patchy areas and also helps decrease the immune system response, which will then decrease the patches. And they tend to only work while being used. Long-term use is not really good for your immune system. And if you use it too much for too long, it will thin your skin.
And they do have some over-the-counter. Most of these are prescription. They do have some over-the-counter steroids that are very low dose. And a lot of times those are strong enough for people to treat them, but they are the lower dose. And so if it's not working, oftentimes you'll need a prescription to get a higher dose if this is your plan of choice.
Calcineurin inhibitors are typically used when steroids are not working, and these are going to reduce the immune system's response to the overactive cell growth. So this is often used when psoriasis is going to be affecting sensitive areas such as the face, the genitals, and folds in the skin.
Calcipotriene, which is Dovanex, is typically used. Now, this contains chemicals closely related to vitamin D. This is actually the one that I like to prescribe. I think it might be one of the last prescriptions from a dermatologist, and I go for it first.
It's just because it's very similar to vitamin D and how it works, and we've talked many times on how powerful vitamin D is, but it just helps decrease the inflammation, and it's been shown to help decrease psoriasis. So this is I consider one of the better ones when it comes to the prescriptions. I mean, you always have to think about it when it comes to treatment. Is your treatment worse than the condition? And that's a real question people have to ask themselves, because when we start getting into some of these treatments out there, some of these treatments are really scary. Now, psoriasis is awful, and it can be really debilitating at times, and especially if you've got the arthritis with it too. But if it's just like plaque psoriasis and it's a rash, and some of the treatments out there are linked to some really nasty stuff, so you have to be really willing to understand the difference between a rash and death.
I think I would choose the rash.
I would choose
if you
the
put
rash.
it that way.
But it is a real choice people have to make, and if they don't understand how some of these treatments work, there's some detrimental potential.
Mm-hmm.
Phototherapy is also used to treat psoriasis, so UVB rays, ultraviolet B light therapy. This is going to use a wavelength of light that's invisible to the human eyes, but the light is going to slow down the production of skin cells, and it's an effective treatment for some types of psoriasis that don't necessarily respond to the topical treatments.
There's also UVA, or Sorlin plus ultraviolet treatment. If you're first given Sorlin by mouth or topically to the skin lesion, it makes the skin more sensitive to light. And UVA is then exposed to psoriasis and will penetrate deeper than the UVB light due to the Sorlin. And this is used for severe psoriasis that's not improving with other treatments.
So again, choose what's the best outcome for you, because long-term use of this has a very high increased risk of skin cancer. So again, rash, skin cancer.
Mm-hmm. It's because of the UVA.
Yeah, it's because of the UVA,
Yeah.
but this is a real treatment that people do get out there.
Mm-hmm.
Drugs. Lots of drugs for this. The most common ones they used to prescribe before the new class of biologics came out are the non-biological drugs. And the most common one they would give is something called methotrexate. They've used this for cancers. They've used this for a lot of different things in the past. It's a major immunosuppressant, so it weakens your immune system. And by weakening your immune system, it's going to decrease that overproduction of skin cells. So naturally, if you decrease the skin cell overproduction, the psoriasis can clear up. But long-term use of methotrexate is linked to
Lots of things: liver damage, fetal development or maldevelopment. So use protection if you are of the age of producing a child.
if you're having sex and you're on methotrexate, you need to be careful.
Mm-hmm.
This is for men and women because it can hurt the male part of reproduction as well as the female.
Cyclosporin is another non-biologic drug that is used. It's also an immunosuppressant, and so it's going to decrease the immune system attacking the skin, which can help to clear up the psoriasis. It was originally used to prevent transplant rejection. So you can imagine long-term, it's going to damage our immune system, which can make you more prone to many conditions, including infections. It also can cause kidney disease as well as high blood pressure.
Now, there are the biologic drugs. We'll talk about those now. But there's Enbrel, which is...
These are all the commercials now.
Okay.
Like every time you watch TV now and they're showing you a new drug where the person's really happy, smiling, and then they read you the laundry list of side effects of that happy person. These are the drugs you're seeing commercials for now. These are the biologic drugs. There's so much money right now in pharmaceutical companies where they are paying like billions and billions of dollars to come out with new biologic drugs. And so many of these are major immunosuppressors.
Yeah, the other one is Humira. These are injections twice a week for 12 to 16 weeks. And then, you know, if there's no improvement in your psoriasis in 3 months, then you move on to the next drug.
Yeah, these are known as TNF inhibitors. So TNF stands for tumor necrosis factor inhibitor. So think about that. Tumor can be cancer. Necrosis, kill. So kills cancer. Inhibitor. So it's inhibiting part of our immune system that can help kill cancer cells. But then they tell you a side effect can be cancer. Well, I said it last week, but no shit, Sherlock. I mean, of course, if you're blocking a part of your immune system that kills cancer cells and then you say a side effect is cancer, well, duh. But this is a very common thing we're using to treat rashes. It's weird.
There's also Remicade. This is a monoclonal antibody IV drip. And you do infusions, you know, for 8 weeks. And then after 10 weeks, if there's no improvement, again, treatment stopped and move on to the next drug. Let's talk about some naturopathic testing.
Okay, let's do.
It sounds nicer. So honestly, it's going to be very similar to the allopathic physical exam because, you know, we need to take a look at things and see what's going on. But we also, this is where we start to differ, we also want to see a food panel, a food allergy and sensitivity panel. And we also want to check their GI fungal markers because we talked about psoriasis being closely related to fungal issues.
One of the main things we're going to be doing when testing for doing naturopathic testing is going to be looking for causes, right? Because we like to treat the cause. So heavy metal toxicity, chronic toxicity of, toxic metals is linked to autoimmunity. Arsenic specifically can sit in skin cells and is linked to many different skin conditions. And there have been cases reported with psoriasis developing after arsenic exposure.
Yeah, I'm still not off my soapbox on the meds. I mean, this is not me trying to be anti-med because I'm not anti-med. I just prefer natural almost every time. But this is not me making this stuff up when I say can cause cancer. You can go on their website. You can watch their commercials, and they will literally tell you, oh, this can cause TB. That can kill you. This can cause cancers that have been shown to kill you. Like, they're saying this right on their website. So this is not me being mean, I promise. I can be mean. This is not it.
I believe you. There's also a urine test that we use. It's a 24-hour urine test, and we want to check those hormones, especially around puberty or menopause, because remember earlier we said that any fast change in hormones can cause psoriasis.
And stool testing. Again, 80% of your immune system is in the digestive tract. So there's some great stool tests out there that assess your good bacteria, your bad bacteria, your secretory IgA, which is linked to GI inflammation, very commonly seen elevated in autoimmune patients. So there's really good ways to see where your immune system stands with regard to your digestive tract.
Yeah.
Today we are talking about psoriasis.
Dr. Ryder here with your tip of the week, and I have some home topical remedies for you to try. If you have the symptoms that we've described here talking about psoriasis, you should consult your doctor and get evaluated for psoriasis. But if you're waiting on an appointment, it's a weekend or a holiday, and your traditional topical creams have run out, here's a few ideas that you can try at home. So, garlic has many healing properties, and it works with psoriasis as well. What you can do is crush garlic cloves, mix them with some oil like sesame oil, or you could even use lard to make an ointment and then apply that externally to the lesions.
That sounds delicious. Minus the lard.
Don't be eating it though. Avocado oil, super easy. You can apply that topically. You can also use ginger. Ginger has tons of healing properties as well. But you would crush 250 grams of fresh ginger. That's about the size of one bulb of garlic, just to give you a visual. Soak it in 500 milliliter bottle of white wine. That's a typical size of a bottle of white wine. And do that for 2 days. Just soak it for 2 days, and then you can apply that externally to the lesions.
Now, we said soak it in white wine, not drink the white wine while soaking in ginger.
Eating ginger
now
and
that
drinking
sounds
wine.
better to me.
Hey, dry January over there.
So now we get to jump into naturopathic treatment options. Of course, we are always going to talk about lifestyle, and this is including, diet. Increased weight is going to increase psoriasis patches. So you want to be eating really clean, avoiding known inflammatory foods that you find on your food panel, or also just the typical ones like sugar, dairy, gluten. But it is better to test it and really individualize your diet to yourself. You can also avoid spicy, fatty, and fried foods. Those could contribute to your psoriasis. And maintaining those blood sugar levels. Like we said, diabetes seems to be linked to a pretty increased risk of psoriasis. So keep in mind that sugar is going to feed fungals, and sugar is also linked to autoimmunity. So maintaining healthy blood sugar levels is really important.
And we mentioned before about smoking and alcohol, and bottom line is you just have to stop. Now you can seek help in stopping, but that is what needs to happen.
If you want to get better.
Correct.
But, sunlight is too much bad, is not enough bad. Yes and yes. I mean, you need to avoid too much sunlight because that can flare psoriasis, but you still need sunlight. You need it for vitamin D. You need it for a few other, benefits that our bodies use. It helps with sleep when you have the right sunlight at the right amount of time. So it is needed, but too much. If you're getting sunburns, other things like that, it increases your risk of psoriasis.
Balancing your hormones can also help target psoriasis. So you can do this with supplements to support your hormones, or even bioidentical hormone replacement therapy if necessary. Yoga also can be helpful. We said stress is a major trigger for psoriasis. So yoga can help to alleviate stress and also improve joint function if, psoriatic arthritis is an issue.
Meditation is another really great way to decrease the stress hormone. And meditation also decreases inflammation because it's reducing the stress, right? And then in turn would reduce psoriasis plaque formations.
And there's lots of different types of saunas out there. Near-infrared saunas often can encourage the shedding of excess skin growth. So the people that are suffering from psoriasis, saunas can be really beneficial at detoxing as well. So if we're thinking about, I need to detox, I have an autoimmune disease, you can not only help your body burn fat, help your body detox, you can also help the body shed some of those unwanted skin cells.
I love infrared saunas. So we do a procedure called ozone IV therapy at Naturopathic Physicians Group. This is really great for psoriasis and any autoimmune disease, honestly. We also do the chelation therapy, which removes heavy metals, and we talked about that earlier as well, with heavy metals being associated and found in those psoriasis plaques.
Yeah, like we talked about the arsenic as a potential cause of psoriasis, but autoimmune diseases in general can be linked to heavy metal toxicity. Lead affects our whole immune system. Mercury affects our immune system. Cadmium affects our immune system. Aluminum affects our immune system. So if you've got an autoimmune disease, I mean, it's one of those tests that is eye-opening to so many people. And I can't tell you how many times someone does these treatments and they're like, I feel so much better after I get this crap out of my body.
Some topical treatments that you can try in addition to Dr. Ryder's tip of the week treatments. Apple cider vinegar can be helpful for psoriasis. Epsom salt baths can also be great. I love those just in general. They're great for a lot of things.
And Epsom salts don't smell like apple cider vinegar, so if you want to smell like a tree outside, you do the apple cider vinegar.
Maybe do apple cider vinegar and then an Epsom salt bath.
Apple trees smell good.
Tea tree oil can also be applied, or you can even find it as an ingredient in a healthy, clean shampoo. So that can be really useful for scalp psoriasis.
And since we were talking about ozone therapy as an IV to treat the autoimmunity, it's great for heart disease. We actually did a whole episode on ozone and oxygen therapies. But they make ozonated olive oil out there as well, where there's just two ingredients in there. It's ozone, which is the oxygen, and then the olive oil. So it can actually be applied directly to the rashes and can start to treat the rashes, and the rashes can start to flake off and clear up. It's an amazing treatment with none of those awful side effects of death.
It stinks a little bit, but it's not death.
It's not death. It doesn't stink as much as death.
Right. Also, aloe vera is really great topically to use. And you can even, we have aloe vera all over the place growing here in the desert. And you can just grab a leaf, peel off the outside, and wipe that right on your skin.
And there's a lot of aloe vera juices out there. Most of them have a ton of sugar. There's a lot of edible aloe vera products out there. Aloe vera tends to work much better for psoriasis when it's topical than it does internal.
Mm-hmm. Internally, it's a bit of a laxative.
Yeah,
so
it'll make you shit.
Keep that in mind if you try taking it internally.
Let's talk about some supplements that you can take to help with psoriasis. Fish oil is really fantastic for skin in general, so that will help with psoriasis. And we talked about vitamin D being super important, and you can use this in a topical cream, like we said, the prescriptions that we were talking about.
Vitamin A is really great for the skin. It's going to reduce the overproduction of skin cells that's happening in psoriasis. It can be used as a topical cream or with oral supplementation.
Yeah, but this is one that you have to use with caution because it can produce well, let me use the non-medical term. It can produce variability in fetus. So if you're going to get pregnant or you have the ability to get pregnant, if you're having sex, basically, don't use vitamin A.
And a lot of the drugs that have vitamin A in there, they'll have big stickers on them that have a warning sign with a pregnant person.
Mm-hmm. A lot of times if you're going to do like a prescription level of a vitamin A topical, you need to be on 2 different forms of birth control before you even start it. So they're typically, if you're working with a physician, as you should be before taking any new supplements, they'll be careful to look out for that.
But think about immune supports. Again, it's an autoimmune condition. So the typical things that you would use for your immune support, vitamin C, zinc, selenium, bioflavonoids, all of the stuff we've talked about almost every single week about immune support, all of these can be taken correctly. When taken correctly, can help your body deal with psoriasis.
Mm-hmm. Vitamin E is another great supplement. And just low levels of vitamin E have been found in individuals who have psoriasis. And this can be supplemented orally or topically, and then just follow your doctor's recommendations for the dosage.
And when studies, because we always talk about studies, the one out there that's been studied many times that seems to do really well is Oregon grape, also known as Mahonia. But this contains a constituent called berberine, which helps decrease inflammation, and it helps decrease the inflammation that leads to the plaque psoriasis. So multiple studies have shown benefits with psoriasis and seems to be, of all the things out there, it seems to be one of the most effective ones at treating it.
You can do this in a tea.
You can do a lot of things as a tea that can help, such as chamomile. But again, controlling your gut as well. Probiotics are really helpful if you've got a GI problem going with it. And if it's fungal, there's stuff like oregano oil, Pod d'Arco, caprylic acid. These are all natural antifungals.
Mm-hmm. And anti-inflammatories like the curcumin and so on.
So thank you for tuning in to Your Health is Wealth. We'll see you next week with another episode.